Now in this session we'll see the drug treatment of angina pectoris and or drug used in the treatment of angina. You can expect one or two questions from this chapter. Morning whatever we have seen that was very important, and this is again very important. Even in GPAT 2022 there was a question on this chapter. So we'll see it about each and every detail regarding the angina pectoris, drug treatment of angina pectoris or anti-anginal drug. So it is again a third chapter from your drug acting on cardiovascular system. We have seen drug treatment of arrhythmia or anti-arrhythmic drugs. After that, we have seen drug treatment of hypertension, that is anti-hypertensive drug, and here we will see anti-anginal drug. And in the last, maybe on Wednesday, we will see drug treatment of congestive cardiac failure. So that will end your drug acting on cardiovascular system. So we'll see here anti-anginal drug. We'll see what do you mean by angina pectoris. So you might have heard the term angina pectoris or chest pain. So chest pain means what? Angina pectoris or chest pain. So angina pectoris is actually not a disease, but it is just a symptoms of myocardial ischemia. Suppose that by any reason, so your heart is not able to get a proper amount of blood or proper oxygen. So at that improper dim oxygen supply, that is known as ischemia. Ischemia means what? Ischemia means inadequate supply of oxygen or blood to the particular tissue. So if your heart myocardial muscle of your heart is not getting proper blood supply or proper oxygen supply, then it is known as ischemia. Okay. Now angina pectoris is not a disease. Actually, it is some symptoms. They are the symptoms of myocardial ischemia produced by a variety of ways. So there are different ways which can produce myocardial ischemia. So one of the most important cause of this myocardial ischemia is nothing but the atherosclerosis. Atherosclerosis means development of development of plaque, development of your thrombus. Okay, so what happens if you eat more fats? Okay, particularly saturated. क्या होता है कि अपन बाहर का जो खाना खाते हैं, जैसे अपन ये खाते हैं, जो समोसे हुए तले हुए समोसे खाते हो, या फिर कोई जो भी तला हुआ जो भी फूड्स है, स्टेपल फूड जिसको बोलते हैं अपन, स्टेपल फूड मीन्स आउटसाइड फूड. तो वड़ा पाव, जो समोसा हो गया. So what happens? They used to they use only one kind of oil over here. तो एक ही ऑयल एक बार मॉर्निंग में उन्होंने ऑयल उसको डाल दिया उनके पतीले में, तो वही ऑयल पूरा पूरा दिन वही ऑयल रहता है वो. So they will not change the oil. And what happens due to continuous heating of that oil? Continuous heating of that oil. So initially that oil was good. Okay, so it was containing unsaturated fatty acid. Initially when they poured the oil in the that utensil, so that oil was having unsaturated fatty acids, means double bond. Okay, so that oil was having double bonds, unsaturation, but due to continuous heating, what happens, that double bond gets lost. Okay, so there is a loss of that unsaturation in the oil due to continuous heating, and that oil becomes saturated one, and saturated oil is harmful for your body. Now what happens due to saturated oil, due to cholesterol? So what happens, increased amount of cholesterol in your body that gets deposited in the arteries, that gets deposited into particularly coronary artery, because coronary artery is very small. Okay, as compared to other arteries, जो बाकी के आपके बॉडी के arteries होते हैं वो थोड़े से large size के होते हैं, but coronary artery is a very small size, and deposition of this fatty tissue or fatty layer, so low density lipoprotein, etc., etc., so low density lipoprotein particularly is harmful. So that is the one of the most important cause for arteriosclerosis. So arteriosclerosis means deposition of fatty material or fatty plaque or fatty thrombus inside the coronary artery. And because of that, there is occlusion. There is occlusion of coronary artery. तो वहाँ पे क्या होता है कि फैटी डिपोजिशन डिपॉजिट हो जाता है कोरोनरी आर्टरी में. कोरोनरी आर्टरी बहुत ही स्मॉल होता है एक, तो वहाँ पे डिपोजिशन होने के बाद में क्या होता है कि वहाँ पे जो कोरोनरी आर्टरी का फंक्शन क्या है, व्हाट इज द रोल ऑफ कोरोनरी आर्टरी? So coronary artery is nothing but the main artery which is responsible for the supply of blood to the whole heart tissue. जो हार्ट का टिश्यू है आपका, हार्ट को भी ब्लड लगता है ना, हार्ट इज आल्सो ए टिश्यू, ही हार्ट इज आल्सो कंटिन्यूअसली वर्किंग. सो ही हार्ट गेट्स energy and nutrition, oxygen from coronary artery. So blood supply to the heart, we have seen that is function of coronary artery. And suppose that if there is a increase in lipid level in the body, if there is a deposition of that fatty layer inside the coronary artery, so what happens? The lumen of coronary artery or the diameter of coronary artery gets smaller, and due to that there is a less blood supply to the myocardium of heart. Okay, so angina pectoris actually is a not disease; it is a symptom of myocardial ischemia. It is produced by a variety of you due to intense emotional feeling. जैसे मान लीजिए कि बिकॉज ऑफ लॉस्ट ऑफ लव्ड वंस, कि आप जिससे आप बहुत ही ज्यादा प्यार करते हो वो अचानक चला जाता है, उसकी देहांत हो जाता है, तो आपको एक शॉक लगता है. बिकॉज ऑफ दैट आपको दैट इज इंटेंस इमोशनल फीलिंग. तो इंटेंस इमोशनल फीलिंग, स्ट्रेनस एक्सरसाइज, तो बहुत ही ज्यादा पावरफुल एक्सरसाइज किया आपने, तो उसकी वजह से भी आपको एंजाइना हो सकता है ड्यू टू इंटेंस इमोशनल फीलिंग, due to strenuous exercise, or due to arteriosclerosis. So due to deposition of fatty layer inside the coronary artery, and that is one of the most and one of the common cause of your angina pectoris. Now what happens? There is a occlusion in the coronary artery, so your coronary artery is not able to supply a proper blood supply to your heart, so your heart will get less blood supply. That means, so your heart requires more blood supply and your heart is getting less supply because of the occlusion of coronary artery. Okay, now this is known as an imbalance between demand and supply. So demand for oxygen is more in the heart, oxygen is dissolved in the blood itself. Okay, so there is a more demand in the heart for the oxygen, but heart is not able to get it because there is a occlusion in the coronary artery, so that result in the chest pain, that result in the angina. So angina pectoris is not a disease, it is a symptom of myocardial ischemia. So because of that decrease the fulfillment of blood and oxygen, so what happens at that particular site where there is occlusion, so these myocardial cells start dying. तो मायोकार्डियल जो से मायोकार्डियम का सेल्स है, उनको अगर न्यूट्रिशन नहीं मिलेगा, उनको ऑक्सीजन नहीं मिलेगा, तो वो सेल क्या होंगे, मर जाएंगे. ठीक है. सो बिकॉज ऑफ दैट improper supply of blood and oxygen to particular area of your myocardium, so your myocardial cells start dying, and that is the term known as ischemia. So angina pectoris actually is not disease, it is a symptoms because of the myocardial ischemia, and that occurs due to variety of ways. Okay, as I have listed some reasons for that. One is the most intense feeling, okay, emotional feeling, most intense emotional feeling, vigorous exercise, then arteriosclerosis or coronary vasospasm. These are the reasons for angina pectoris. Now due to that, due to this reason, there is an imbalance between demand and supply of oxygen to the myocardium, and you will get anginal pain. Physiology of tone of blood vessel. Blood vessel का physiology कैसा है? How there is a control of tone. Okay, so first of all you should understand the angina pectoris, then physiology of tone of blood vessel. Now what happens in the blood vessel, in the inner layer of blood vessel, inner layer of blood vessel is known as endothelium. So inner layer of blood vessel is known as endothelium. In the endothelium of blood vessels, there are in the endothelium of blood vessel, in the inner layer of blood vessel, there are certain local chemicals which are synthesized in the endothelial layer of your blood vessels. So we have seen what do you mean by angina. There is an absolute imbalance between demand and supply due to blockage of coronary artery, or due to intense emotional feeling due to exercise, and due to imbalance or due to less supply of oxygen and blood, that particular tissue start dying. वहां पे टिश्यू की डेथ होती है, उसको बोलते हैं इश्चेमिया, दैट इज अ मायोकार्डियल इश्चेमिया. So angina pectoris is not disease, it is just symptom of myocardial ischemia. This physiological tone of blood vessel, endothelial cell, okay, endothelial layer of your blood vessel, so it produces some chemicals, some vasoconstrictor chemicals and some vasodilator chemicals. So endothelial cell control the vascular tone. मतलब blood vessel का मसल जो है, वेस्कुलर स्मूथ मसल कंस्ट्रिक्ट करेगा या रिलैक्स होगा, वो डिसाइड करने के लिए एंडोथेलियल लेयर जो है वो केमिकल्स रिलीज करता है वहां पे. So endothelial cell controls the vascular tone by producing the vasodilators such as prostacyclins. Prostacyclin is nothing but the vasodilator. Prostacyclins and endothelium derived relaxing factor. EDRF. EDRF means endothelial derived relaxing factor. It is nothing but the nitric oxide. Okay. So nitric oxide and prostacyclins, these are the vasodilators, and there are certain vasoconstrictors also. So this endothelial layer produces some vasoconstrictor compound and vasodilator compound. So vasodilators like prostacyclins and nitric oxide. Vasoconstrictor compound like endothelin and thromboxane A2. So एंडोथेलियल लेयर ऑफ ब्लड वेसल, इनर लेयर ऑफ ब्लड वेसल, ब्लड वेसल के अंदर का सबसे जो इनर लेयर है वो क्या करता है कि टोन कंट्रोल करता है, वो कंस्ट्रिक्ट कितना होगा, रिलैक्स कितना होगा ब्लड वेसल, वो कौन डिसाइड करता है, एंडोथेलियल लेयर. कैसे? बाय प्रोड्यूसिंग सम केमिकल्स, some are vasoconstrictor, some are vasodilator, for example prostacyclin and nitric oxide, endothelium derived relaxing factor. EDRF means nitric oxide. Okay. Then vasoconstrictor compound like endothelin and thromboxane A2. Now these two will constrict the blood vessel, and prostacyclin and nitric oxide will dilate the blood vessel. So that's how the endothelial layer of your arteries and veins, they used to control the tone of your blood vessel. Now, what is nitric oxide? Nitric oxide is nothing but it is a vasodilator compound. Nitric oxide is a vasodilator compound. It is known as endothelium derived relaxing factor. इसके ऊपर क्वेश्चन आता है. EDRF, endothelium derived relaxing factor. It is known as a nitric oxide. It is synthesized inside the blood vessel in the endothelial layer of blood vessel. Okay, so it is synthesized from one amino acid known as a arginine. Arginine amino acid is used as a precursor for the synthesis of nitric oxide, and it is done by nitric oxide synthetase. That is one enzyme which synthesizes the nitric acid known as a nitric oxide synthetase. It will synthesize the nitric acid from this arginase. Okay, so nitric oxide synthesis, there are different type of nitric oxide synthesis. There are type 1, type 2, type 3. This was question in GPAT 2022. I will explain this. So nitric oxide synthesis is the enzyme which catalyzes the conversion of nitric acid from arginine. So there are three types of nitric oxide synthetase: NOS, small n, NOS, nitric oxide synthetase. Type 1 nitric oxide synthetase, it is present in the high concentration in the natural and non-natural tissues, neutral and natural and non-natural tissue. Type 1 nitric oxide synthesis. Type 2 nitric oxide synthesis, they are found in the macrophages. Macrophages means macrophage cell of your blood. ब्लड में जो मैक्रोफेजेस होते हैं उसमें टाइप 2 नाइट्रिक ऑक्साइड सिंथेसिस होता है. देन कपर सेल आर फाउंड इन द लीवर. ओके, सो देन फाइब्रोब्लास्ट, vascular smooth muscle, neutrophils and endothelial cells. So type 2 nitric oxide is found in the endothelial cell, neutrophils, then vascular smooth muscle, macrophages, Kupffer cell. Okay, type 1 and type 2, type 1 and type 2. Now there is a type 3 again. Okay, so remember type 1 and type 3 are constructive enzyme. They are constructive enzyme. Means type 1 and type 3. Type 1 and type 3 are constructive, while type 2 is expressed in the resting cells and it is inducible. So type 2 inducible है, type 1 and type 3 constructive. Constructive मतलब उसका हाउसकीपिंग फंक्शन होता है, that is very important for body. Type 2 जो है वो inducible है, induce कर सकते हैं उसको. Now type 3 nitric oxide, it was first identified as an enzyme that produces endothelium derived relaxing factor in the vascular endothelium. So remember इसके ऊपर how many types of nitric oxide synthesis are present in the human body, ऐसा क्वेश्चन था GPAT 2022 में, आप जाके चेक कर सकते हो. So there are three kind of nitric oxide synthesis: type 1, type 2, type 3. Now what is nitric oxide? Nitric oxide is nothing but the endothelial derived relaxing factor. endothelium जो है blood vessel का, वहाँ पे कुछ कंस्ट्रिक्टिव vasoconstrictive compound बनाते हैं और कुछ vasodilator compound बनाता है endothelial layer. So what are the vasoconstrictive compound? That is endothelin and thromboxane A2. Vasodilator compound was prostacyclin and nitric oxide. So these four compounds, they are synthesized in the vascular endothelium. Okay, and particularly nitric oxide is synthesized from arginine amino acid. And there are four kind of enzyme. Those catalyzes the conversion of arginine into nitric oxide. So what are these enzymes? Type 1 nitric oxide synthesis, type 2 nitric oxide synthesis, type 3 nitric oxide synthesis. Okay, so remember there are three nitric oxide synthesis. तो ये किसी के भी बुक में एग्जांपल नहीं था, ये टाइप का मेरे बुक में था. किसी की भी बुक में ये क्वेश्चन का आंसर नहीं था, सिर्फ मेरे बुक में था. और कुछ जो रेफरेंस बुक होते हैं जैसे रंगेंडेल एंड टेनवर वगैरह, so in that also they have mentioned both this type of nitric oxide. There are three type of nitric oxide सिंथेटाइज एंजाइम। ओके, इसके ऊपर जीपैट 2022 में क्वेश्चन था। नाउ you might be clear regarding angina pectoris, why it is happening. So what is the problem exactly? So angina pectoris is, what is the problem? Whatever the coronary arteries are there, so this one is the coronary artery. Okay, so that will supply blood to myocardium of your heart. ये दो myocardial artery होता है, myocardium coronary artery, that will supply blood to myocardium, because myocardium is also a tissue, living tissue. It will also need energy. And now what happens, due to emotional stress, or due to strenuous exercise or vigorous exercise, or due to increased lipid level in the body, deposition of fatty layer inside the coronary artery. coronary artery के अंदर fatty layer deposition होता है, और वो occlusion होता है, उसका occlusion होता है, वो बंद हो जाता है, थोड़ा कम हो जाता है, and that because of that occlusion your myocardium will not get proper blood supply. Okay, blood supply means oxygen supply, because in the blood oxygen is dissolved. So what happens, due to decrease the supply of oxygen to the myocardial cell, so myocardial cells start dying, they dies, and this is known as the myocardial ischemia. And because of that there is a intense chest pain. chest pain होता है, normally chest pain अंदर होता है, लेकिन that chest pain is known as a referred pain. Okay, whatever pain is arising from your heart, that will travel to your backside, from neck to the backside and left hand. So it will travel to the left hand, neck and backside of left side. So that is known as a referred pain. Now what are the treatment approaches for this? तो इसमें ट्रीटमेंट क्या क्या कर सकते हो? तो आपको मालूम है कि मायोकार्डियल इश्चेमिया क्यों हुआ है? बिकॉज ऑफ इम्प्रॉपर ब्लड सप्लाई। ब्लड सप्लाई इम्प्रॉपर क्यों हुआ है? कि मोस्ट ऑफ द इम्पोर्टेंट कॉज क्या है कि आर्थरियोस्क्लेरोसिस, की जो आर्टरी है कोरोनरी आर्टरी, उसका ऑक्लूजन हुआ है, तो उसको ऑक्लूजन रिमूव करो. So you have to dilate that coronary vessel. You have to remove that plaque. You have to remove that thrombus, whatever is deposited in the coronary artery. You have to remove the occlusion. So what are the treatment approaches? So you first one will be vasodilation. Second one will be your decrease in the lipid content or anti-hyperlipidemic drugs. Okay, these are the two. Then again there are certain approaches. You can decrease the workload of your heart. You can decrease the workload of your heart. How you can decrease the workload? So you can decrease the workload of your. There are two terms, preload and afterload. What do you mean by preload? What do you mean by preload? So whatever the blood which are present in the atrium, whatever blood which are present in the atrium during, oh sorry, whatever the blood, whatever the amount of blood is present in the ventricle during ventricular contraction, that is known as the preload. That is known as a preload. And whatever blood is there after complete ventricular diastole, जब वेंट्रिकल रिलैक्स होंगे उसके टाइम पे उसमें कितना ब्लड है, दैट इज नोन एज आफ्टर लोड. So preload means the blood amount of blood present in the ventricle during the ventricular contraction, that is known as a preload. And whatever blood is present in the ventricle after ventricular relaxation, that is known as afterload. Okay, so you can decrease the preload, you can decrease the afterload, so that you can decrease the workload on your heart. So that is also another treatment approach. So there are different drugs which are used in the treatment of your your angina pectoris. So you can reduce the afterload by using this drug, calcium channel blockers and nitrates. You can reduce the preload by using nitrates. Then you can using those drugs which are having negative inotropic effect, means that will also decrease the rate of contraction and force of contraction. That means workload of heart will be decreased. So negative inotropic drug like beta blockers, calcium channel blockers, delta. Coronary dilators example is calcium channel blocker and nitrates. Don't worry, we are going to see the classification 3-4 times. It is just targets. Okay, तो आपको ये मालूम होना चाहिए कि angina pectoris क्यों हो रहा है, because of the blockage of coronary artery. Blockage क्यों हो रहा है coronary में? Coronary artery वैसे भी बहुत ही small होता है आपका, और वहाँ पे लिपिड लेवल आपका बढ़ने के कारण होता है. जैसे आपका बॉडी में लिपिड लेवल बढ़ जाएगा, लो डेंसिटी लिपोप्रोटीन. So if there is a increased low density lipoprotein, that will cause deposition, that lipids will be cholesterol and low density lipid will be deposited inside the coronary artery, and they will occlude the blood vessel. That is known as a arteriosclerosis. Arteriosclerosis is one of the most important cause for angina pectoris. There are certain other causes also. For example, intense emotional behavior. बहुत ज्यादा खुशी हो गई, होता है ना वो, कि बहुत ज्यादा खुशी हो गई और खुशी खुशी में ही चल बसे, विकेट गिर गए. So वो भी because of the angina, बहुत ज्यादा आपको दुख हो गया, कोई आपका चाहने वाला गुजर गया, उसमें भी आप दुखी हो जाते हो और उसमें भी आपका एंजाइनल पेन आता है, ठीक है, ड्यू टू vigorous exercise also. So we'll see what is effect of nitric oxide. Okay, so nitric oxide, we have seen the nitric oxide is the endothelium relax factor, so it will relax the blood vessel. Okay, so what is the effect of nitric oxide? So first one is the direct effect. So direct effect of nitric oxide, which is mediated by itself, and it is produced by interaction of okay, so whatever nitric oxide is there, it will get entry into the myocardial cell. It will increase the concentration of gonocyte. Okay, it will increase the concentration of cyclic GMP by interacting with the guanyl cyclase. This nitric oxide will interact with the guanyl cyclase, which increase the functioning of guanyl cyclase and increases the cyclic GMP in the cell. Okay, or increase the cyclic GMP in the cell, that means cell will relax. Now this guanyl cyclase is also known as a receptor for nitric oxide. This is the direct effect. Now indirect effect is mediated by interaction of reactive nitrogen with oxygen and superoxide radicals and cytotoxic peroxynitrite ion. So effect of nitric oxide. Nitric oxide will release the blood vessel by two ways. First one is a direct action and second one is indirect action. So direct effect means what? Nitric oxide will be transported into intracellularly and will stimulate the guanyl cyclase function. Which is nothing but the receptor for nitric oxide, and activation of this guanyl cyclase will increase the cyclic AMP in the inside the cell. So increase the cyclic AMP inside the cell causes vasodilation. And indirect effect is because of the ions. Indirect effect is mediated by interaction of reactive nitrogen with oxygen, superoxide radicals, and cytotoxic peroxynitride anion. So we'll see the mechanism in the detail in the next slide. I will explain with the diagram, with the diagrammatic way. Functions of nitric oxide. What are the function of nitric oxide? So vascular smooth muscle relaxation. ब्लड वेसल का जो मिडल लेयर होता है, मस्कुलर लेयर, so उसको रिलैक्स करना. So vascular smooth muscle relaxation. Nitric oxide release causes the decrease in the influx of calcium in the endothelial cell. Impaired production of this nitric oxide is implicated in the hypertension, cerebral and coronary vascular. मतलब क्या है कि improper or inadequate production of this nitric oxide in the blood vessel is responsible for the hypertension, cerebral and coronary vasospasm, then arteriosclerosis, then ischemic reperfusion injury. So inadequate production of this nitric oxide is responsible for these things: hypertension, cerebral coronary vasospasm, then arteriosclerosis and ischemic perfusion injury. Arteriosclerosis के लिए एक cause हो सकता है. Another cause, main important cause is increase the lipid level of your body. अगर बॉडी में लो डेंसिटी लिपोप्रोटीन ज़्यादा होगा तो आर्थेरोस्क्लेरोसिस हो जाएगा. And arteriosclerosis is the one of the most common cause for angina pectoris. Now next is nitric oxide and RBCs. Nitric oxide RBC में भी होता है, red blood cell में. So where nitric oxide has a role in the RBC, so it will prevent the sickling of RBC. So RBC का जो shape change होता है, sickle cell anemia में जो sickling होता है सेल का, that will be prevented by this nitric oxide. So it will prevent the sickling of RBC, and therefore this arginine is amino acid nowadays used in the sickle cell anemia. Now nitric oxide causes the inhibition of platelet aggregation. जो platelet aggregation होता है वो उसको inhibit कर देगा. Now platelet aggregate होगा तो वहाँ पे clot form हो जाएगा. Clot form हो गया तो और भी coronary blockage हो जाएगा. Nitric oxide causes the it inhibit the platelet aggregation and it causes smooth muscle relaxation. Now there are certain cholinergic nerve which are supplemented to smooth muscles of your blood vessels, esophagus, then corpus conversum. So this is the area of your male sexual organ, corpus conversum. So nitric oxide will also is responsible for the erection in the male. So whatever penile erection is there in the male, nitric oxide is also responsible for that. Now what happens? So nitric oxide will stimulate the adenyl cyclase enzyme inside the cell, and it will increase the concentration of cyclic GMP in the cell. That causes the relaxation. Now what happens? That cyclic GMP is metabolized by one enzyme known as the phosphodiesterase. Cyclic GMP का metabolism करता है एक enzyme phosphodiesterase. and that's why phosphodiesterase inhibitors are also used in the erectile dysfunction. वो अलग chapter है, वो बाद में बोलूँगा. Now endothelin is nothing but it is again a compound synthesized in the vascular endothelium which causes vasoconstriction. There are different types. For example, endothelin 1, endothelin 2, endothelin 3. Out of these, endothelin 1 is the most potent. Now, what do you mean by anginal index? Anginal index is calculated is equal to anginal index is equal to heart rate into systolic blood pressure. So it is a formula for anginal index. Now, there are different types of angina pectoris. What are the different types? There are three types. First one is known as a classical angina, or it is also known as a stable exertional angina. First one is a classical angina and also known as a stable exertional angina, and it is the most common form of angina pectoris. Remember this classical angina or stable exertional angina, also known as angina with effort, and it is produced by unusual physical exercise. So अगर आपने बहुत ही स्ट्रेनस एक्सरसाइज किया और अचानक एक्सरसाइज किया, जैसे मान लीजिए कि 2 साल तक आपने कुछ जिम में गए नहीं और अचानक जाके 50 kg उठाया, तो उसमें क्या होता है कि आपका कोरोनरी वेसोस्पाज्म होता है. कोरोनरी वेसोस्पाज्म आने के बाद आपको चेस्ट पेन होता है. दैट इज नोन एज अ क्लासिकल एंजाइना और स्टेबल और एक्सर्शनल एंजाइना. So it is also known as angina with effort produced by unusual physical exercise or intense emotional status. Can be removed by just simply rest or using organic nitrates. So there is a depression of EST wave. If you carry out the ECG of that patient, so EST wave जो होता है लास्ट का, तो वो कम होता है. डिप्रेशन ऑफ EST wave in the ECG and severe atherosclerotic affiliation of a large coronary arteries. मतलब यहाँ पे arteriosclerosis भी cause हो सकता है उसका. Now second type of angina is known as a variant angina or prismental angina. Second type of angina is known as a variant angina or prismental angina, and it is uncommon. Now it is also known as a vasospastic angina. And angina at rest. It is characterized by chest pain, EST elevation. EST segment जो है ECG का वो थोड़ा सा ऊपर उठ जाएगा, EST elevation. It is known as a vasospastic angina. It is also due to coronary artery stable angina. Next, third type is the unstable angina. So it includes the different variety like chronic unstable angina, angina after myocardial infarction, and it is mainly due to atherosclerotic plaque. मतलब आर्थ्रियोस्क्लेरोसिस हो गया आपका, तो उसकी वजह से भी होता है अनस्टेबल एंजाइना. ये मायोकार्डियल इंफेक्शन की वजह से भी होता है, हार्ट सर्जरी के बाद में भी होता है. ओके, देयर आर डिफरेंट रीजन फॉर अनस्टेबल एंजाइना. variety it includes of variety of angina like chronic unstable angina after myocardial infarction, or it is mainly due to atherosclerotic deposition of atherosclerosis or plaque deposition of plaque, occasionally associated with the coronary vasospasm. Now, drug used in the angina. What are the different drug used in the angina? There are different classes of drug. For example, nitrates like glyceronitrate, nitroglycerin. NTG means nitroglycerin or glyceronitrate, nitroglycerin, isosorbide dinitrate, or and other drugs are also there. And second class will be your calcium channel blockers. So first class is the nitrate. Okay, second class is nothing but the calcium channel blockers, verapamil and diltiazem. These are the two drugs. Okay. Third class is nothing but the beta blocker. For example, propranolol, atenolol, metoprolol. Then potassium channel openers. So nicorandil and all this, pinacidine, nicorandil, etc. They are known as a potassium channel blocker. Fourth class will be partial fatty acid oxidase inhibitor. Partial fatty acid partial fatty acid oxidase inhibitor. Okay. Trimetazidine and ranolazine. So this was a question again in GPAT. So one of the following drug is a partial fatty acid oxidase inhibitor. So partial fatty acid oxidase inhibitors are nothing but trimetazidine and ranolazine. तो ये क्या होता है partial fatty acid oxidase inhibitor, ये बोलता हूँ. Now you can say next class is nothing but the sodium channel blockers. In that you have again ranolazine and ivabradine, ranolazine. So these are the different classes 1, 2, 3, 4, 5. There are 6 classes of drug used in the angina pectoris. Again we will see the classification of drug कि कौन से drug इसमें angina pectoris में use किए जाते हैं. So first one is nothing but the organic nitrates. Okay. First one is nothing but the organic nitrates. Okay. So they are nothing but they will give quick relief from anginal pain because they are nothing but the vasodilator. They are nothing but the vasodilator and they will give quick relief of anginal pain, immediate relief of anginal pain. They are the drug, okay, drug of choice. So particularly this nitroglycerin is a drug of choice. Organic nitrate. So in that also you have two types of they are used for purpose. First one is for quick relief during attack, acute attack. जैसे अटैक आता है उसमें रिलीव करने के लिए ड्रग ऑफ चॉइस इज नथिंग बट द नाइट्रोग्लिसरीन. So NTG, nitroglycerin is the drug of choice for relieving the acute attack of angina. Then for prophylaxis means prevention. Prophylaxis means what? Prevention. For the prevention of angina also they are used nitrates, organic nitrates. Okay. So for example, here you have that isosorbide dinitrate and other drugs. Okay. Now second class is calcium channel blockers. Calcium channel blockers they are used for prophylaxis only. They are not used for treatment. Okay. Now third class of drug is nothing but the beta blockers. Beta blockers they are also always used for prophylaxis and sometimes they are used for treatment. So these are the drug. Again we will see what are the different anti-anginal drug or drug treatment of angina pectoris. Classification दो तीन बार लेता हूँ क्योंकि important है. First one is the organic nitrates. In that you have two subtype, short acting and long acting. Short acting कौन से इसके ऊपर क्वेश्चन आता है, long acting कौन से इसके ऊपर क्वेश्चन. So there was question in GPAT 2019. One of the following organic nitrate is a long acting. Long acting. Question में ये option था isosorbide dinitrate. So it was the answer. So first see short acting nitrates. So glyceryl trinitrate, isosorbide dinitrate, subliminal. They are known as a short acting drug. Subliminal isosorbide dinitrate that is a short acting, but if you use orally isosorbide dinitrate that is a longer acting. Then isosorbide mononitrate is a longer acting. Then erythritol tetranitrate that is also longer acting. Erythritol tetranitrate. Then pentaerythritol tetranitrate that is also longer acting. यहाँ पे याद रखो मोनोनाइट्रेट, डाइनाइट्रेट, मोनोनाइट्रेट, ड्राइनाइट्रेट एंड ट्राइनाइट्रेट, टेट्रानाइट्रेट जिसमें ग्लिसरीन नहीं है. आइसोसोर्बाइड मोनोनाइट्रेट, आइसोसोर्बाइड डाइनाइट्रेट, इरिथ्रिट्रॉल टेट्रानाइट्रेट, then penta erythritol tetranitrate. These are the longer acting nitrate, organic nitrates. इसके बारे में क्वेश्चन आ चुका है. Now second class is the beta blockers. Okay, beta adrenergic blockers. For example, propranolol, metoprolol, atenolol, and other drugs. And third class is calcium channel blockers. In that you have verapamil, diltiazem, amlodipine, nitradipine. Okay, so amlodipine, nitradipine, so dihydroxypyrimidine. They are mostly used in the treatment of angina pectoris. जो nimlodipine, amlodipine, nitradipine, these kind of drugs they are mostly used. Verapamil, diltiazem, they are seldomly used. Next one is a potassium channel openers. Next class is a potassium channel opener. So nicorandil, minoxidil, pinacidil, they are the drug. Other anti-anginal drug, so they are trimetazidine, ranolazine, ivabradine, and oxyphenetrin, dipyridamole. Okay, dipyridamole. Dipyridamole is an anti-platelet agent. We have seen in the very beginning when we were discussing about the coagulant and anticoagulant. Dipyridamole, aspirin, dipyridamole, clopidogrel. We have seen that. And trimetazidine is a partial fatty oxidase inhibitor. So ranolazine and this trimetazidine, they are the PPOX inhibitor. Okay, इसके बारे में क्वेश्चन आ चुका है. So now we'll see again the classification. So first is nothing but the organic nitrates. Organic nitrates in that you have different classes: short acting, long acting. ये मेरा classification है. Long acting, short acting, and volatile. So which one is a short acting? Nitroglycerin is a short acting. Which one is a longer acting? Isosorbide dinitrate, isosorbide mononitrate, erythritol tetranitrate, pentaerythritol tetranitrate. Remember, volatile is nothing but the amyl nitrate. So volatile is given by nasal route. Amyl nitrate is given by nasal route, and isosorbide dinitrate is given by subliminal route. So when it is given by subliminal route, it acts as a short acting. When isosorbide dinitrate is given by oral, it will act as a long acting. Now second class is a beta blocker, so propranolol, metoprolol, atenolol, etc. Third class is a calcium channel blocker. In that you have different type like phenylalkylamine derivative like phenylalkylamine, phenylalkylamine derivative like verapamil, benzothiazepine like diltiazem, then dihydropyrimidines like nifedipine, amlodipine, felodipine, nitrodipine, nimodipine, benidipine, and lacidipine. Dipines are the dihydropyrimidines. Remember, dipines are the dihydropyrimidines. Nifedipine, amlodipine, felodipine, nitrodipine, benidipine, and lacidipine. Then this was the third class. Now fourth class is nothing but the potassium channel openers like nicorandil and pinacetyl. Okay, so these are the main classes. Then another class is there known as a partial fatty acid oxidase inhibitor. The mechanism of action of your nitrates or mechanism of action of your anti-anginal drug. So anti-anginal drug act by dilating the coronary artery. एंजाइना में क्या होता है कि कोरोनरी का ऑक्लूजन होता है और उसका ल्यूमेन कम होता है, नैरो होता है, एंड दैट्स व्हाई ब्लड सप्लाई कम हो जाता है. एम इज टू डायलेट द कोरोनरी आर्टरी. सो anti-anginal drug they act by dilating the coronary artery or reducing the cardiac workload, and that is done by reducing the preload and afterload. Now, currently used drug act by this mechanism. First, they will reduce the afterload. For example, calcium channel blocker and beta blockers nitrate. They will reduce the afterload. What do you mean by afterload? So, whatever blood is there in the ventricles before ventricle contracts, that is known as afterload. Okay, preload, whatever blood is there in the ventricles after complete relaxation, that is known as a. So preload is reduced by this nitrates. Now negative inotropic action. Some drug act as a negative inotropic drug on the heart. They will decrease the functioning of your heart and they will decrease the energy consumption. Beta blockers and calcium channel blockers, they are known as a negative inotropic drug. They will decrease the force of contraction and heart rate. Coronary dilators, for example, calcium channel blockers and nitrates. These are the anti-anginal drug act by this way. So they reduces the preload, they decreases the afterload, they act as a negative inotropic on heart, and they are a coronary vasodilator. Now we'll see the individual drug. So first is nothing but the organic nitrates. Okay, organic nitrates. What are the pharmacological action? So organic nitrates are reduced to organic nitrites. So whenever you will give organic nitrate like isosorbide dinitrate or any drug, that will be reduced into nitrites. So nitrates का reduction, okay, nitrites बनेगा, and when then the nitrites then later on they are converted into nitric oxide. पहले nitrates जो organic nitrates उनका reduction होके organic nitrites बनेगा. Nitrites का बाद में क्या बनेगा? Nitric oxide, which acts as a direct vasodilator because nitric oxide is endothelium relaxing factor. So they releases the nitric oxide into the cellular endothelium. Okay? And, they serve as a source of nitric oxide without involving the endothelial cell. तो normally endothelial cell nitric oxide बनाता है, लेकिन अभी coronary vasodilation करना है तो ये जो organic nitrate है वो देने के बाद उसका reduction होता है nitrates में और nitrates बाद में nitric oxide बनता है. Okay? And वो causes the vascular relaxation. Now, what are the actions of organic nitrates on the cardiovascular system? So first, hemodynamic action, blood के ऊपर क्या action है? So they causes relaxation of systemic and venous as well as arterial bed. मतलब क्या? ये arteria जो arteries है, arteries and veins both दोनों को relax करते हैं. मतलब the vasodilation of arteries as well as veins. They will decrease the blood pressure. Action on systemic venous. Action on systemic venous मतलब क्या? जो वेनस ब्लड है, जो रिटर्न ब्लड आता है उसको बोलते हैं कैपेसिटेंस. सो वट एवर वेनस ब्लड इज दैट इज नोन एज कैपेसिटेंस. एंड आर्ट्रियोलार ब्लड दैट इज नोन एज इम्पेडेंस. वेनस ब्लड है उसको बोलते हैं कैपेसिटेंस, जो आर्टरी में ब्लड होता है उसको बोलते हैं इम्पेडेंस. ओके, दे बोथ रिड्यूसेस कैपेसिटेंस एज वेल एज इम्पेडेंस. ब्लड प्रेशर से आने वाला है वेनस से रिटर्न, सो वेनस रिटर्न जो आने वाला है उसको बोलते हैं कैपेसिटेंस. And whatever the blood that is being pumped out through arteries by pressure, that is known as a impedance. And they preload means what? End diastolic left ventricular pressure. Preload means end diastolic left ventricular pressure. Okay? एंड आफ्टर लोड मीन्स रेजिस्टेंस टू लेफ्ट वेंट्रिकुलर इंजेक्शन। यहाँ पे देखो प्री लोड मतलब क्या है, प्री लोड मतलब जो वट एवर ब्लड इज देयर इन द वेंट्रिकल्स आफ्टर ventricle relax, that is the preload. And afterload means what, रेजिस्टेंस टू द लेफ्ट वेंट्रिकुलर इजेक्शन। जब वेंट्रिकल कॉन्ट्रैक्ट होता है तब जब आउट में ब्लड जाता है तो उसके लिए एक रेजिस्टेंस पैदा होता है, दैट रेजिस्टेंस इज नोन एज आफ्टरलोड। So they reduces preload as well as afterload. They reduces capacitance as well as impedance. Okay, that's why this reduction leads to less energy to the left ventricle, less energy demand to the left ventricle. Now again, what is the effect on coronary circulation? Because of the coronary resistance and increase in the total coronary blood flow, because they dilate the coronary blood vessel and increases the coronary blood flow, so that myocardium will get proper blood. Dilation of large epicardial coronary arteries, lateral arteries, redistribution of coronary blood flow with the improved perfusion in the ischemic area. जहाँ पे ब्लड नहीं जा रहा था तो वैसोडाइलेशन की वजह से यहाँ पे ब्लड ज़्यादा जाएगा. So they will increase the blood flow to the myocardium by dilating the coronary blood vessel, coronary artery. So initially, large coronary arteries are dilated, and then it will distribute the coronary. It will cause redistribution of coronary blood flow with the improved perfusion to the ischemic area. Actions in the angina. So they act in a patient with angina by increasing the exercise tolerance. नॉर्मल क्या होता है, जिसको एंजाइना पेक्टोरिस है वो एक्सरसाइज नहीं कर सकता, एक्सरसाइज जैसे ही करने लगा उसको चेस्ट पेन हो जाता है. So these nitrates they increases the exercise tolerance without increasing the anginal index. They probably achieved by reducing the oxygen consumption on the heart, the submaximal exercise. That's how that is a organic nitrates. क्वेश्चन इसके ऊपर आ जाता है आपको कि one of the following is not a mechanism for nitrates in case of angina. They reduces the preload. Second option, they reduces the afterload. Third option, they improve the perfusion rate in the ischemic area. ऐसा कुछ ऑप्शन देके आपको कंफ्यूज करेंगे. तो इतना एक लॉजिकली याद रखो कि एंजाइना में क्या हो रहा है कि आपकी मायोकार्डियम को ब्लड नहीं जा रहा है. ठीक है, ब्लड नहीं जा रहा है तो वहाँ पे ब्लड जाने के लिए आपको क्या करना पड़ेगा, कोरोनरी वैसोडाइलेशन करना पड़ेगा ताकि वो वहाँ ज़्यादा ब्लड जाए, कोई परफ्यूजन हो जाए इन द इस्चेमिक एरिया. ठीक है, एंड दो काम करना है आपको. whatever there is a occlusion of coronary artery, you have to relax it. फर्स्ट को coronary artery रिलैक्स करना है. दूसरा काम क्या है, जो हार्ट का काम है उसको कम करना है. सो हार्ट का जो काम है उसको कम कैसे करेंगे, बाय रिड्यूसिंग द प्रीलोड एंड बाय रिड्यूसिंग द आफ्टरलोड. तो हार्ट के ऊपर जो लोड है वो कम करो, तो वो प्री लोड हो या फिर आफ्टर लोड हो उसको कम करो तो हार्ट का लोड कम हो जाएगा. और हार्ट का लोड कम हो गया तो हार्ट को अपने एनर्जी कम लगेगा. एंड दैट इज द, अगर एनर्जी कम लग रहा है और कोरोनरी परफ्यूजन इंप्रूव हो रहा है, दैट इज वेल एंड गुड. ऐसा है. ठीक है, एंजाइना में क्या होता है कि हार्ट का काम बढ़ रहा है लेकिन हार्ट को ब्लड सप्लाई नहीं हो रहा है, हार्ट को ही नहीं हो रहा है, वो काम करते जा रहा है और ब्लड सप्लाई कम हो रहा है. तो ऑब्वियसली आपको खाना नहीं देंगे और 24 आवर्स काम करो विदाउट खाना नहीं देंगे और काम करो तो आप थक थक के मर जाओगे. तो वैसे ही होता है मायोकार्डियल इश्चेमिया. अदर वेस्कुलर बेड के ऊपर क्या एक्शन है, दूसरे वेसल्स, ब्लड वेसल, दूसरे मतलब पेरिफेरल ब्लड वेसल वाके. सो रिलैक्सेशन ऑफ ब्लड वेसल्स ऑफ स्किन. ब्लड वेसल को क्या करेंगे, रिलैक्स करेंगे. तो उसमें क्या होगा, आपको एक फ्लशिंग मतलब वार्मनेस, गरम होता है. जब आपका ब्लड वेसल डायलेट हो जाता है तो वहाँ पे ब्लड वेसल डायलेट होने के कारण वहाँ पे ये permeability increase होता है and that leads to flushing. Meningeal blood vessel result in the throbbing rate. So dilation of meningeal blood vessel, जो आपका cerebral blood vessel है उसको dilate करता है, because of that it causes headache, throbbing headache. Pulmonary blood vessels के ऊपर क्या है, decreases the pulmonary arterial pressure and also reduction in the blood flow to the kidney. That is the actions of nitrate on the other vascular blood. बाकी ब्लड वेसल पे क्या एक्शन है, पहले तो अपन ने देखा कोरोनरी ब्लड वेसल पे और क्या एक्शन है. एब्सॉर्प्शन, डिस्ट्रीब्यूशन, मेटाबॉलिज्म, एलिमिनेशन. दे आर रेडिली absorbed from subliminal route, and you know that subliminal route there is a no first pass effect over. So they are absorbed by subliminal route, bypass effect, first pass, or bypass is the first pass effect. Oral or transdermal or inhalation formulations are also available. पर्टिकुलरली इनहेलेशन किसका रहेगा, अमाइल नाइट्रेट। अमाइल नाइट्रेट क्या है, वोलेटाइल ऑर्गेनिक नाइट्रेट है। सो इनहेलेशन किसका रहेगा, अमाइल नाइट्रेट। Nitrates undergo first pass metabolism if they are given orally. Nitrates undergo very high first pass metabolism if they are given orally. Now, what are the adverse reactions? Headache. क्यों हो रहा है headache? Because of dilation of cerebral blood vessel. That can be controlled by aspirin. Okay, headache is due to vasodilation, cerebral vasodilation, and that can be controlled by your aspirin. Now again, hypotension and syncope. Hypotension and syncope because of the dilation of blood vessel, it results in the hypotension. Transient episodes of giddiness, weakness, and other signs of cerebral ischemia associated with the postural hypotension, especially when the patient stands immobile. जैसे आप खड़े हो तो उस टाइम पे आपका हाइपोटेंशन हो जाएगा. cold sweat, nausea, vomiting, okay, involuntary passage of urine and feces. बैठे बैठे ही सुसु कर दोगे. The tolerance. So now tolerance to this vasodilation, dilatory action of nitrate develops. Tolerance to various actions like anti-anginal action, headache develops. Okay, and again cross tolerance is also common. मतलब अगर आपको आइसोसोर्बाइट डाइनाइट्रेट को टॉलरेंस है तो अमाइल नाइट्रेट को भी टॉलरेंस हो जाएगा. Tolerance. Then next one is the withdrawal symptoms. So if you stop sudden treatment of nitrates, sudden stoppage of therapy can precipitate the severe angina due to coronary vasospasm. ठीक है, सडन स्टॉप नहीं करना है, धीरे धीरे विड्रॉ करना है, धीरे धीरे ट्रीटमेंट करना है. सडनली आपने अगर 8 दिन नाइट्रेट ले लिया, 9वें दिन बंद कर दिया, so you will get coronary vasospasm and again angina. So you have to stop the treatment day by day. So you don't have to stop suddenly. So miscellaneous action क्या है, pentaerythral tetranitrate commonly reduces the drug rash. So nitrates are nothing but the vasodilator, and you don't have to use these drug with the phosphodiesterase inhibitor. So sildenafil and other phosphodiesterase inhibitor, they are contraindicated with the nitrates. तो phosphodiesterase inhibitor क्या करेंगे, जो नाइट्रेट्स करते हैं, नाइट्रेट क्या करते हैं, जैसे सेल में लगाएंगे एडेनिल साइक्लिक्स को स्टिमुलेट करते हैं. एडेनिल साइक्लिक को स्टिमुलेट करके एडेनिल साइक्लिक्स क्या करता है, तो साइक्लिक जीएमपी बढ़ता है, एएमपी से जीएमपी बढ़ता है. So increased cyclic GMP in the cell causes vasodilation. Okay. Now जो GMP है उसको मेटाबोलाइज करने वाला एंजाइम होता है phosphodiesterase. Okay. Now phosphodiesterase will metabolize the GMP. Okay. So if phosphodiesterase inhibitors are used, so that means there is an increase in, or there is a no metabolism of cyclic GMP. There is ultimately increase in the level of cyclic GMP. That will also cause vasodilation. So अगर ये दोनों साथ मिलेंगे तो बहुत ज़्यादा क्या होगा, हाइपोटेंशन होगा. So that's why phosphodiesterase inhibitor and its nitrates, they are contraindicated. What are the therapeutic uses of this drugs? Organic nitrate के therapeutic uses क्या है? All varieties of angina pectoris at onset of pain in acute myocardial infection. Okay, myocardial infection. So they are used in the all kind of angina like segmental angina, variant angina, and all that. And they are also used in the to relieve the acute pain due to myocardial infection. In paroxysmal nocturnal dyspnea, left ventricular failure, acute left ventricular failure, congestive cardiac failure, and acute anal fissure. उसमें use करेंगे. So all variety of angina, okay, at onset of pain in acute myocardial infection, paroxysmal nocturnal dyspnea. Dyspnea मतलब सांस नहीं आ रहा है, रात में अगर सांस नहीं आ रहा तो उसको बोलते हैं नॉक्टर्नल डिस्पनिया. In left ventricular failure, acute left ventricular failure, congestive cardiac failure, and acute anal fissure. So it is the uses. Now another use is there in case of cyanide poisoning. Okay, cyanide poisoning के बारे में भी इसका use है. Cyanide poisoning. In case of cyanide poisoning, amyl nitrate inhalation is used in the cyanide poisoning. Amyl nitrate inhalation. Now what happens in the cyanide poisoning? Normally cyanide poisoning में क्या होता है कि cyanide जो है वो cyanide, so cyanide will combine with the hemoglobin and produce cyanomethylglobin. And cyanomethylglobin जो बनता है, so that cyanomethylglobin inhibit the cytochrome oxidase of the cell. Cytochrome oxidase को inhibit करता है और cellular respiration stop कर देता है. आपका सेल में ऑक्सीडेशन ही नहीं होगा किसी चीज का, आपका सेल ऑब्वियसली मर जाएगा. तो साइनाइड क्या करता है, साइनाइड जैसे आपने आपके बॉडी में गया, so it will combine with the hemoglobin and it will convert into cyanomethaglobin, and cyanomethaglobin will inhibit this complex, will inhibit cytochrome oxidase enzyme, and which is then your cell will be not able to do respiration, okay, and cell will die. Now what happens if you give amyl nitrate, okay, and other nitrates? So nitrates convert the hemoglobin to methemoglobin. Nitrates convert hemoglobin to methemoglobin, and methemoglobin competes with the cytochrome oxidase for cyanide ion. ठीक है, इन केस साइनाइड पॉइजनिंग में आपने ये नाइट्रस दिया, तो नाइट्रस क्या करेगा, साइनाइड को हटा देगा और वो हीमोग्लोबिन के साथ में कंबाइन हो जाएगा और वो बनाएगा methemoglobin, okay, methemoglobin, and methemoglobin will compete for cytochrome oxidase for compete करेगा cytochrome oxidase के साथ, इसके साइनाइड आयन के साथ फॉर द साइटोक्रोम ऑक्सीडेज, सो दैट मेथामोग्लोबिन जैसे फॉर्म होता है तो साइनाइड आयन जो है वो साइटोक्रोम ऑक्सीडेज जो एंजाइम है उसको इनहिबिट नहीं कर पाता, ओके, so that's how they are useful in the cyanide poisoning. Now combination of methemoglobin with the cyanide result in the formation of cyanomethaglobin. cyanomethaglobin बनता है, तो methemoglobin बना है उसके साथ में cyanide combine होके आयन cyanomethaglobin बनता है, which is a non-toxic product, which is a non-toxic and it can be excreted in the kidney. So that's how cytochrome oxidase is prevented from the cyanide ion. cytochrome oxidase को prevent करना है from cyanide ion. ये मैं और एक बार एक्सप्लेन करता हूँ आपको. Then another drug is there known as a molcidomide. Molcidomide is a new emerging drug for nitrate category, from the nitrate category, and tolerance to this drug does not develop. तो बाकी जो nitrates है उसका tolerance develop होता है. So tolerance to anti-anginal activity of nitrate develops normally. Now this molcidomide is a newer drug from this nitrate, and tolerance to this drug does not develop. Remember the uses of this nitrate. Cyanide poisoning में भी nitrate का use है. यहाँ पे देखो angina pectoris है, left ventricular failure है, congestive cardiac failure है, anal pressure है, myocardial infarction है, acute pain in the myocardial infarction. Okay, ये uses है. तो cyanide poisoning में क्या करता है ये nitrates? They will combine with the hemoglobin, they will form methemoglobin. Now methemoglobin जैसे बनता है वो cyanide निकल जाएगा बस, and they competes with the cyanide ion for the cytochrome oxidase, and cytochrome oxidase inhibition is prevented, and then cyanide ions combines with the methemoglobin, and then methemoglobin can be easily removed from body through the kidney. Okay, that's how they act as an antidote for cyanide poisoning. We'll see the mechanism of action of these nitrates. So nitrates का mechanism क्या है? So nitrates का mechanism similar है, similar nitrates and so hydrazine जो है, hydrazine is a vasodilator. It will act similar way like nitrate. Okay. So whatever nitric oxide is there, organic nitrates or nitric oxide, it will enter into the cell. Okay. It will enter into the and it will activate guanyl cyclase, guanyl cyclase, which converts GTP into cyclic GMP. Increase the cyclic GMP level in the cell causes vasodilation. Increase the cyclic GMP causes which will free the cytosolic calcium. Cytosol में जो calcium है उसको free करेगा and that will cause relaxation, vascular smooth muscle relaxation. Nitric oxide guanyl cyclase. So nitric oxide or they gets reduced into nitrites, and nitrites they release the nitric oxide. Okay, nitric oxide will enter into cell. It stimulates the guanyl cyclase, and then guanyl cyclase will increase the cyclic AMP in the cell. This increased cyclic AMP frees the cytosolic calcium, which causes the relaxation. So this is how nitrates will act. Okay. Again, you can see over here. So nitrates means what? Endothelium derived nitric oxide means endothelial derived relaxation factor. It will increase the it increase the cyclic GMP in the vasomotor muscle into so it converts the cyclic GTP into cyclic AMP, and cyclic AMP causes decrease in the calcium level vasomotor smooth muscle, which causes relaxation of vascular smooth muscle by EDR. Now in case of cyanide poisoning what happens? So normally cyanide poisoning में hemoglobin जो होता है उसके साथ में cyanide combine होकर cyanomethaglobin बनता है, cyanomethaglobin, और वो inhibit करता है cytochrome oxidase को. Now in that case if you give nitrate, Nitrates will combine with the hemoglobin and will form methemoglobin. Methemoglobin बनाएगा किस ओके methemoglobin बनाएगा तो साइनाइड जब हीमोग्लोबिन के साथ में कंबाइन होता है तो साइनोमिथाग्लोबिन होता है तो साइनाइड प्लस मेथाग्लोबिन बनेगा साइनोमिथाग्लोबिन तो उसके साथ में अगर सोडियम थायोसल्फेट आप देंगे तो सोडियम सल्फेट क्या करेगा थायोसाइनेट को अलग करेगा एंड थोड़ी सोडियम सल्फेट अलग होगा and now that can be easily excreted in the kidney. That's how it is useful in the cyanide person. Now next we'll see other drugs like beta blocker. Other drugs like beta blocker, they are used in the all stages of ischemic heart disease except prismental and vasospastic variant angina. Beta blockers इसमें यूज नहीं करना है किसमें prismental angina and vasospastic angina में यूज नहीं कर रहे. Beta blockers, okay, beta blockers they are not a coronary vessel dilator. Beta blockers will not dilate any coronary artery. What will they do? They will decrease the functioning of heart. So beta blockers block the actions produced by sympathetic activity. Now in angina, what happens? Angina, exercise, and emotional excitement cause induce the angina. Exercise and emotional excitement can induce the angina, which will result in the increased heart rate. Heart rate, blood pressure, myocardial contractility, and metabolism of myocardial tissue, oxidative metabolism of myocardial tissue. All these are nothing but the sympathetic activity. Now, these all activities are blocked by beta blockers. So they increases the exercise tolerance like nitrate without increasing the anginal index and prevent both subject to ECG manifestation and cardiac ischemia. ये क्या करेंगे वो हार्ट का लोड कम करेंगे ठीक है का एक्टिविटी कम करेगा हार्ट जो बीट कर रहा है जो फोर्स ऑफ कॉन्ट्रैक्शन है उसको कम करेंगे ताकि हार्ट को एनर्जी कम लग जाए the exercise tolerance they are not they are not useful in the prismental or vasospastic angina vasospastic and variant angina long term use long term use of beta blockers long term use of beta blockers after myocardial infarction has been shown to reduce the rate of reinfection and sudden death. लॉन्ग टर्म अगर बीटा ब्लॉकर यूज करेंगे तो वो बेनिफिट है उसमें बेनिफिटेड है so because they reduces the rate of in reinfection and sudden death मतलब angina pectoris की वजह से क्या होता है myocardial infarction होता है जैसे infarct मतलब क्या so if there is a occlusion of blood vessel by clot then it is known as a infarct अगर वहाँ पे प्लेटलेट एग्रीगेशन हो गया क्लॉट फॉर्म हो गए and due to that there is a blockage that is known as an infarct. Now if that infarct moves from coronary artery to a small coronary arterioles that will block the coronary arterioles and whatever the blood supplied is by that arteriole so that area will be died that is known as an infarct. And if there is a large kind of area is involved in the heart known as a myocardial infarction. Adverse reaction to the anti-anginal therapy. Adverse reaction of beta blocker to anti-anginal. Adverse reaction of beta blocker as anti-anginal drug. So precipitation and aggravation of congestive heart failure. Okay, with the beta blocker. Along with the digoxin, beta blocker along with the digoxin must be watched for development of heart block. So beta blockers and digoxin साथ मिलेंगे तो heart block भी हो सकता है. तो थोड़ा सा मॉनिटर करना पड़ेगा. Development of severe syncope using nitroglycerin or nitrate in patient with the beta blocker and it is contraindicated in the variant angina. Now calcium channel blockers used as an anti-anginal drug. So mechanism of action क्या है? They will block the calcium ion channel and will prevent the calcium entry into myocardial cell by inhibiting the L type of calcium channel. So they will prevent the depolarization and they will decrease the heart rate, force of contraction, and also relaxes the smooth muscles of blood vessel. These drug can also bind to the alpha 1 subunit of they binds to alpha 1 subunit of L type of calcium ion channel and prevent the entry of calcium inside the cell. So they decrease the workload of heart. They decreases the force of contraction. Okay, they have negative inotropic effect. Like verapamil, diltiazem are negative inotropic agent. They will decrease the force of contraction, and they should not be combined with the beta blockers for the treatment of angina. With anti-arrhythmic effect is also there. We have seen that. These drugs decreases the rate of discharge from SM node and suppresses the ectopic pacemaker activity. Now effect on coronary arteries क्या है उसका? They are a potent coronary dilator and can prevent the spasm of arteries. Can be used in the prismental angina. Prismental angina में बीटा ब्लॉकर्स नहीं यूज करना है, मेंटल एंजाइना में क्या यूज करना है, कैल्शियम चैनल ब्लॉकर्स. इफेक्ट ऑफ पेरिफेरल ब्लड वेसल, इफेक्ट ऑन पेरिफेरल ब्लड वेसल. So decrease in the vascular resistance of blood pressure in the both arteries. बोथ टेरिटरीज जैसे वेन्स एंड आर्टरीज दोनों में क्या करेगा, डिक्रीज इन द वेस्कुलर रेजिस्टेंस, मतलब प्रीलोड कम करेगा. नाउ अगेन निपेडिपिन इज द मोस्ट पोटेंट vasodilator than verapamil. Remember the anti-anginal property. Anti-anginal property of calcium channel blocker are due to two reasons. First reason is nothing but it is due to two reasons. First is improvement of coronary blood flow. Second one is the decrease in the oxygen demand of heart due to reduction in the systemic vascular resistance and blood pressure. So they will decrease the oxygen demand and they will improve the coronary blood. That's why they are useful in the angina. Now another drug is known as a verapamil, calcium channel blocker. Verapamil causes the suppression of AC node, AV node, which is calcium dependent, and it causes the coronary dilation as well as peripheral vasodilation. It causes AV block, potent antiarrhythmic drug है, and it is a potent negative inotropic effect. So it causes the suppression of SN node, AV node, which are calcium dependent. So it will inhibit the entry of calcium into SN node, AV node. Then coronary and peripheral vasodilation, it can cause AV block, atrioventricular block, potent antiarrhythmic drug. Okay, and it has a negative inotropic force of contraction. First action क्या है, constipation, vertigo, bradycardia, heart block, congestive cardiac failure, hypotension and edema, ankle edema याद रखो, इसके ऊपर क्वेश्चन आ चुका है. So what is the adverse effect of verapamil ankle edema? और एक ड्रग है उसका adverse effect है ये, उसका नाम है nifedipine. Nifedipine also causes ankle edema. Now next drug is the diltiazem. It has a less negative inotropic action than verapamil and nifedipine, and that should be avoided in the patient with the congestive cardiac failure. Now nifedipine, it is a more potent coronary and peripheral vasodilator and has a negligible negative inotropic effect. Potent inhibitor of platelet aggregation. Potent inhibitor of platelet aggregation. It also relaxes the bronchial and uterine. Adverse reaction क्या है देखो, headache, tachycardia, dizziness, fatigue, orthostatic hypotension, leg cramps, skin rashes and gingival hyperplasia. Gingival hyperplasia मतलब क्या? gingival hyperplasia मतलब आपका जो गम्स है, गम्स जो टीथ एंड गम्स है उसका ब्लीडिंग करेगा. जिंजिवल हाइपरप्लासिया. जिंजिवल हाइपरप्लासिया इज एडवर्स इफेक्ट ऑफ अनदर ड्रग नोन एज फिनिडोइन. फिनिडोइन जो एंटी इपिलेप्टिक ड्रग है उसका भी एडवर्स इफेक्ट होता है जिंजिवल हाइपर. नाउ थेरापेटिकली दे आर यूज्ड इन द वेरिएंट एंजाइना रिफ्रैक्टरी टू द resistant to the nitrate therapy. They are used in the treatment of variant angina which are resistant to nitrate therapy. They are also used in the treatment of hypertension and Raynaud's syndrome. Nicardipine, iradipine are similar drug with the nifedipine. Amlodipine, felodipine. Amlodipine and felodipine, they are known as second generation dihydropyrimidines. Amlodipine and felodipine. Nimodipine is a preferentially dilates the cerebral arteries. Nimodipine क्या करेगा, cerebral में ज़्यादा active है. It will dilate the cerebral blood vessel. All these calcium channel blockers are contraindicated in case of tight aortic stenosis. Tight aortic stenosis मतलब क्या है, aorta जो है आपका, aorta हार्ट का aorta, उसका aorta अगर ब्लॉक हो गए तो उसको बोलते हैं टाइट aortic stenosis. सीवियर मायोकार्डियल डिप्रेशन एंड हार्ट ब्लॉक, उसमें ये यूज नहीं करना है. क्लिनिकल हार्ट फेलियर, अनस्टेबल एंजाइना एंड एक्जिस्टिंग हाइपोटेंशन, इसमें भी यूज नहीं करना है कैल्शियम चैनल ब्लॉकर्स. Now next one is nothing but the potassium channel openers. Potassium channel openers, they are nothing but the nicorandil and pinacidil. Potassium channel activating property along with the nitric oxide donating property. So they opens the potassium ion channel as well as they gives nitric oxide. They are prepared on the venous side by reducing the preload, but also on arteriolar side. They are used as alternate therapy for nitrates. अगर नाइट्रेट नहीं यूज कर सकते तो पोटेशियम चैनल ब्लॉकर यूज करो. नेक्स्ट वन इज एंटी प्लेटलेट एजेंट. सो एस्पिरिन जो है, एस्पिरिन इज एंटी प्लेटलेट एजेंट. सो इट इज यूज्ड prophylactically. Prophylactically means to prevent the angina. So it is used in the prophylactically in the myocardial infarction in patient with stable and unstable angina. Dipyridamole is also antiplatelet agent. It is a weak coronary dilator. देन साइटोप्रोटेक्टिव मतलब सेल को प्रोटेक्ट करने वाले। एंड जैसे आपका ये हो गए तो इच्छेमिया हो गए तो वो सेल डाई जाएगा, मर जाएगा। सो साइटोप्रोटेक्टिव मीन्स दोज विल प्रिवेंट द सेल डेथ। सो ट्राइमेटाजिडीन calcium channel blocker with cytoprotective effect. Trimetazidine is a calcium channel blocker with cytoprotective effect on myocardium metabolism in presence of ischemia, and they are nothing but the partial fatty acid oxidase inhibitor. Partial fatty acid oxidation inhibitor. Now next drug is a ranolazine. So it is an approved drug and it is a first line drug for chronic angina and does not have any effect on heart and blood pressure. It is also safe with the phosphodiesterase inhibitor like serotonin. It can prolong the QT interval in the ECG and it is contraindicated with the patient with significant liver and kidney disease. It is not used to treat the acute anginal episodes. It is a first line agent, first line drug approved for treatment of angina. Ranolazine. It is again partial fatty acid oxidation inhibitor. In evaporating, it acts by a hyperpolarization of sodium ion channel known as a funny current channel. So इसके ऊपर भी क्वेश्चन आया है. So funny current channel inhibitor, sodium ion channel or funny current ion channel inhibitor. Evaporating. Okay. Phosphodil is nothing but the selective Rho A or Rho kinase inhibitor. This enzyme plays a very important role in the myocardial infarction and cardiac remodeling. It is used in the angina and cerebral vascular. So this was regarding the angina. Now, what do you mean by myocardial infarction? What do you mean by myocardial infarction? So जैसे कोई coronary artery block होता है due to deposition of fatty layer और arteriosclerosis बोलिए या फिर due to some uh, thrombus clot formation. So there is occlusion of any artery and that whatever that artery will supply blood to particular area. If there is a blockage of that artery, so the blood area where there is which that artery will supply the blood will be start drying. That area will not get proper blood flow and proper oxygen. So that cell will die. That is known as a ischemia. Okay. So myocardial infarction means what? So coronary heart disease is very important cause for premature death in the developed countries. Okay, and such breaking of such plaque or such clot in the coronary artery result in the occlusion or thrombus formation result into acute myocardial infarction. जैसे कोई coronary artery block होता है उसमें अगर प्लेक होगा, प्लेक मतलब फैट डिपोजिशन, वो अगर ब्रेक हो गया उसके वो प्लेक अगर ब्रेक हो गया तो वो छोटे छोटे आर्टरीज में जाता है और ऑक्लूजन करता है। वहाँ पे जो भी ब्लड सप्लाई करने वाले जो आर्टरीज है जिस एरिया को, वो एरिया पूरा ब्लड सप्लाई बंद हो जाता है, उसको वैसे सेल का डेथ होती है मायोकार्डियल सेल। दैट इज नोन एज अ मायोकार्डियल इंफेक्शन। नाउ दिस प्रोसेस टेक्स develop slowly around 6 to 8 hours, and after this there is a cell death or cell death in the infracted area, or that is known as a myocardial infarction. So cell death of myocardium due to insufficient blood supply to the myocardium is known as a myocardial infarction. Okay? Now, what are the drug treatment or treatment objective for myocardial infarction? So treatment objective should like decrease in the myocardial ischemia and prevent the cell death. Treatment objective should be there. You have to decrease the myocardial ischemia and prevent the cell death by any condition. So there are different drugs used in the myocardial infarction. First one is a analgesic because इसमें पेन बहुत होता है हार्ट पेन. So morphine 10 milligram or pethidine 50 milligram intravenously. They can decrease the pain. But pethidine is no more used. Pethidine इसको यूज नहीं करेंगे because pethidine is a respiratory depressant. They decreases the pain, anxiety. Diazepam also can be used. Thrombolytics is whatever the clot is formed inside the blood vessels of heart. So you have to break that clot. For that you have to use thrombolytics. We have seen this thrombolytics in very first lecture when we was discussing about the anticoagulant and coagulant. Okay, so streptokinase, urokinase, then this alteplase, okay, tenecteplase, retaplase, and antistraplase, anistraplase, urokinase. These are nothing but these all drugs are known as a plasminogen activator. These drugs are nothing but the plasminogen activator. इसके ऊपर भी क्वेश्चन आ चुका है. ये plasminogen activators. So urokinase, streptokinase, and place, antaplase, retaplase, tenectaplase, etc. All these are the plasminogen activator. Plasminogen activator मतलब plasminogen को एक्टिवेट कर देगा. वो plasminogen जो फाइब्रिन के थ्रेड्स है जो क्लॉट फॉर्म हो चुका है उसको ब्रेक कर देगी. It will convert insoluble fibrin into soluble fibrin so that the clot will be broken down. So thrombolytic, particularly streptokinase is used in a dose of 1.5 million units intravenously in the interval of 1 hour so that myocardial patient can be saved. You have to start this treatment as early as possible within the 6 days. Okay, you have to continue this treatment for 6 days and 12 hours. That can decrease the damage and reduce the mortality. You have to start this treatment as soon as possible within the 6 to 12 hours so that they can decrease the so that there will be decrease in the mortality and there is a decrease in the damage of myocardium. So these thrombolytics are used. Thrombolytics जो thrombus बना है जो clot बना है उसको break down कर देंगे. कौन? Streptokinase, urokinase, antaplase, tenectaplase, retaplase. These are nothing but the plasminogen activators. Now antiplatelet agents. So antiplatelet agents they are mostly used for the prophylactic purpose. So aspirin 300 milligram reduces the mortality and improves the effect of thrombolysis in acute myocardial infarction. And prophylactically they can be used in a dose of 75 to 150 milligram daily. Being an antiplatelet agent, this aspirin will prevent the platelet aggregation and thrombus formation and it can be used prophylactically for treatment of myocardial infarction. Myocardial infarction की prevention के लिए ये aspirin 75 milligram to 150 milligram per day देते हैं, ठीक है. And if patient is allergic to the aspirin or if aspirin is contraindicated, then you can use clopidogrel. Now oxygen in a high flow you have to introduce in the patient so that you can save the patient. Oxygen with high flow should be given in the inhalation to the patient. Now again, other drugs which are used in the myocardial infarction treatment. So these are nothing but the beta blockers. So intravenous atenolol you have to use intravenous atenolol over a 5 minute interval, which produces the short term which decreases the short term mortality. That means क्या होता है कि मायोकार्डियल इन्फेक्शन की वजह से एरिथमिया भी आता है. So to prevent that arrhythmia, intravenous atenolol 5 to 10 milligram over 5 minutes. They will produce they will decrease the short term mortality, lowers the incidence of arrhythmia. Then antiemetic drugs, for example, antiemetic drugs are also good. Antiemetic drugs to prevent the vomiting. Then suitable anti-arrhythmic drug is also good, like atenolol and all that. This is how there is a treatment approach of myocardial infarction. Okay, you can see over here. So if there is a decreased blood flow to the myocardium due to occlusion of coronary blood vessel due to their arteriosclerosis or due to thrombus formation. So that leads to myocardial ischemia. Okay, myocardial ischemia मतलब less blood supply, less oxygen supply to myocardial cells that causes the cardiac pain or cardiac pain. So to reduce that cardiac pain, you can use analgesic like morphine, pethidine. And because of that pain and cardiac pain, patient will have anxiety and apprehension. To reduce that, you can use diazepam. Due to ischemia, there is a over sympathetic outflow. Sympathetic stimulation होता है. Ischemia की वजह से क्या होता है कि हार्ट स्टिमुलेट हो जाता है और हार्ट स्टिमुलेट हो जाता है, एड्रेनलिन का रिलीज होता है. To prevent that, you can use beta blockers. In the ischemia, there is an increased cardiac workload. There is an increased cardiac workload and decreased cardiac efficiency, so that you can use here vasodilators to decrease the cardiac workload and to increase the cardiac efficiency. अगर ये मायोकार्डियल इन्फेक्शन कम नहीं हुआ, वर्सन अगर बहुत ज़्यादा है, ये कमी नहीं हो रहा है उनकी वजह से, so you have to use these drugs known as a fibrinolytic or antithrombolytics, fibrinolytic or thrombolytics. So urokinase, streptokinase, antaplase, tenectaplase, these vasodilators and oxygen, वरना क्या हो जाएगा, आपको मायोकार्डियल सेल का डेथ हो जाएगा. This was regarding the treatment of myocardial infection. Anti-anginal drug and myocardial infection. It is over. Anybody has doubt, they can ask.